Yeah, so shall I start, Harshita?
Yes, ma'am. The recording is on. You can start, ma'am.
Okay. So namaste. चतुर्मुखसमारम्भाम् वाग्भटाचार्यमध्यमाम् अस्मदाचार्यपर्यन्तं वन्दे गुरुपरम्परा रागादिरोगान् सततानुशक्तान् अशेषकाय प्रसदान शेषान् औत्सुक्यमोहरतितान् जगान युव पूर्ववैद्या नमोऽस्तु तस्मै. So I'll just switch off the video. I think there is some range issue. So very happy to be with you all again. So we will be discussing one of the very important chapters that we as Ayurveda physicians have to deal in day-to-day life, Vatavyadhi chikitsa. That too from Sushruta Samhita, because I think Sushruta, when it comes to Kaya Chikitsa chapters, I have always felt Sushrutacharya to be very specific in many aspects, very to the point with respect to clinical observations and clinical points where to deliver and how specific to deliver. So, in that perspective, remembering and Okay. So, आमाशयगते वाते छर्दयित्वा यथाक्रमं देयः षड्धरणयोगः सप्तरात्रं सुखाम्बुना चित्रक इन्द्रयव पाढ कटुक अतिविष अभय वातव्याधि प्रशमन योगः षड्धरण स्मृतः. So this षड्धरणं yogam, which is having chitraka, indrayava, padha, katuka, ativisha, abhaya, which is Vatavyadhi prashamana. There is another षड्धरणं yogam mentioned in Kushta chikitsa, wherein one drug is replaced by Darvi. So there Darvi Kalingaga Patol. So Darvi is replaced there when it comes to Kushta chikitsa. But here in Vatavyadhi chikitsa, so very specifically, Amashayagate Vade Chardayitva Yathakramam. So first in Amashaya, so we must understand the affinity of Shaddharana towards Amashaya. So he says, Yatha Kramam, if there is Amashayagata Vata Lakshanas, then Chardi has to be done, Chardana has to be done, that means Vamana has to be done. And in that background, after that Vamana, this Shaddharana Yoga can be prescribed for almost 7 nights. So what includes Shaddharana? Why it is called Dharana? What is the relevance of Dharana? That things are included under the commentary told by Delhana. So when we say Amashya Gatavada, so why, how can we understand how a clinical situation is Amashya Gatavada? So there, if we go to the Vatavyadhi Chikitsa, Vatavyadhi Nidana of Sushruta, there, Vayuhu Amashaye Kruddhaha Chardyadin Kurute Gadan Moham Murcha Pipasamcha Hridgaham Parshva Vedana. So Amashayagata Lakshanas include Murcha, Moham, Pipasam, Hridgraham, Parshva Vedana. So many a times, patients experience difficulty or heaviness. Just now I have coming from one of our colleagues suffering. We were having a meeting and suddenly she developed some discomfort in the chest with heaviness and Parshva Vedana and all. We gave 5 Dhanvantara Gutika and she just burped up. Okay. So that indicates Amashayagata Vata Lakshanas only. See, Amashayagata Vata Lakshanas include Moham, Murcha, Pipasam, Hridgraham, Parshva Vedanam. Thus comes on and off. Chardyadin Kurute Gadan. So Gada that include Chardyadin. So we have to consider it as Amashayagata Vata Lakshana. Amashayagata Vada. So there, if this is recurrently happening, we must understand it is Amashayagata Vata. Treatment definitely would be Vamana, then followed by Shaddharana Yoga. So you could see in the commentary by Delhana, he comments, Prathamam Amashayagata Vayoho Chikitsa Mahaha Amashay Tyadi. Chardayitva means Vamanam Karayitva. Vamanam cha sa utkleshe purushe bahudoshe balavati neyam. Amashayagate Chardanam Kabhasthanatvad. So Chardanam is indicated because Amashaya is Kabhasthanatvad. Yatha Kramam iti. So when the word Yatha Kramam is included in the shloka, Delhana indicates Yatha Kramam iti atra Yatha Krama Shabdena Purvakala Aparakala Kartavyataha Sarvaihi Vakshitaha Sneha Svedana Pana Laingika, Vaigika, Manika, Kaya Shuddhihi, Samsarjana, Bhojanaadayaha. So when he says Yathakramam Chardayitva, it indicates when he says, so Delhana is guiding us. When the word Yathakramam is included, it says Purvakala, Aparakala Kartavyata activities have to be understood. which include actually when we are thinking of just chardana, it is not just chardana. It has to be preceded by snehana and svedana, and then the kaya shuddhi in terms of laingiki, vaigiki and maniki, which must be followed by samsarjana bhojanadayaha. Deyaha iti datum arhaha. So who are indicated for vamana. Then he speaks about Shadharana iti Shannam Chitrakadinam Dharanam Manavishesham Yatra Yoge Sa Shadharana Yogaha. So all the 6 dravyas, including Chitraka, Indrayava, Padha, Katuka, Ativisha, Abhaya, which is replaced by Darvi. Katuka is replaced Darvi in Kushta Chikitsa. In that context, each have to be included as dharana pramana. And what is dharana pramana? Again, he explains. Further, actually, Delhana explains the relevance of the word dharana and inclusivity of dharana pramana. Tatra dharana pramanam madhyamaihi ekavimshatibihi nishpavaihi bhavati sukhambuna ishad ushnaambunaha ityarthaha. Shadharanani katam saptadinani upayunjyate. Why saptadina? It has been told uchyate. Ekasmin dine karsha yogaha sa cha ashtadasha nishpavaihi bhavati. Tatra shadharanebhyah pratidinam trayaha nishpavaha uchrita bhavanti. Tataha shadbihi trikaihi ashtadasha nishpavaihi taihi ashtadashavaihi Saptamam dinam puryate athava sapnesha shadharanam iti. The context over here is an Acharya says about using shadharanam. Delhana gives us a clue that why Acharya has specifically mentioned for 7 days. He says smaller dose can be included and the dosage can be increased day by day, and it reaches on the 7th day till it reaches as Shadharana on the 7th day. So one dharana he says as there he says one dharana means dharana pramanam ekavimshati nishpavaihi bhavati. So each day you start with 3 nishpava, increase. On the 7th day it becomes 7 nishpava, that is 20. I mean, on 7 day it becomes 21 nishpava. So basically, dharana pramanam is almost 6 grams considered, and 6 into 6, it's 36 grams. So initially, first day 1 gram each of the content is used, which is increased every day till the 7th day, so that this is the practical, so that this much, the dosage is increased every day. Now, practically, this is used, I have heard, we practically use Shadharanam tablet or Shadharanam churnam, 5 gram each per day with hot water. First day we start with 5 gram each per day. After 2 days, we make it into 10 grams. So earlier I had heard senior Vaidyas with this who present with Amasya Gadavata Lakshanas, who have they make these individual drugs as powders. 2 grams each they take for the then they increase the dose, and no other medication is given. Only this particular thing is given. Usually first Koshta Shodhana is done, but not commonly Vamana is practiced. Commonly Virechana is practiced, or just Koshtanulomana is given, which is followed by the intake of Shadharana Yoga. But now we are practicing it as 5 gram BD as powder or Shadharanam tablet. I personally prefer churnam. I have got good results with the churnam than tablets. But if the patients are not at all having compatibility with Shadharanam churnam, then I prefer tablets. And here actually this Shadharana Yogam, we have availability as Chitrakadi Kashayam. So wherever there is Samavastha with Amasya in the background, Chitrakadi Kashayam is given internally because it has got a very deeper level action for correcting the amavastha, I think till up to Mamsamedas asti. So Chitragadi Kashayam with Shaddaranam tablet or Chitragadi Kashayam is made, is advised to make at home for almost 21 days in the initial stage, wherever, you know, this Samavastha, wherein Rasa, Rakta Dushti, in Amavata conditions, very commonly this particular format is used. Even though Acharya has mentioned this in Amashagata Vata Chikitsa, in practice, almost every Samavastha, wherein Rasa, Rakta, Mamsa, Medas, up to Mamsa, Medas is involved, Chitragadi is used, whether it is in the Vadrakta Samprapti or in Kushta Samprapti. 1 second. Yeah. Then moving on, so that is why Idanim Shadharna Yoga Mahaha Chitragatyadi Katuka Adivshakshapa Vatavyadhi Prashamanati Amashe Gata Eva Vatavyadhi Grihitavyaha Na Punaha Akshepakadayaha. So he says Amashe Gata Vatavyadhi Prashamana only has to be considered. Ruksha Vishayatvena Vatakaritvadasya. It is Ruksha. So that is why in Akshepakadayaha it is not to be considered. अन्ये तु महाव्याधि प्रश्मन इति पठन्ति महाव्याधिः इहः मेदोयुतो अनिलः न अन्यः. So some other people read it as Vatavyadhi Prashamana, mean instead that Mahavyadhi Prashamana, there is a Pata Veda, Delhana says Mahavyadhi Prashamana iti instead of Vatavyadhi Prashamana, and he gives us a clue that Mahavyadhi iha Medo Yutaha Anilaha na Anyaha. So Amashe Gatavata and the dhatu, the level of dhatu infliction would be Rasa, Rakta, Mamsa and Medas. Okay, so that can be a clinical thing that he can give us an idea. Then the next one is Pakvashe Gatavata, what he says. Pakvashe Gatavata, Pakvashe Gate Chapi Deyam, Sneha Virechanam, Vastayaha, Shodhaniyasta, Prashasta Lavanottaraha. So, how will we understand Pakvashe Gadavada? Pakvashayo. So, Shula, Anaha, Antra Pujanam, Triga Prishta, Vadma, Ashma, Triga Prishta Graham, Vadma, Ashma Graham. So, Shulam. So, these are all the indications of Pakvashe Gadavata Lakshana. Tastra Pakvashe Krudha Shulana, Antra Pujanam. So similarly, even Susruta Nidana says Pakvashyasta Antra Pujanam Shulam Nabhav Karoticha Trutsra Mutra Purishatvam Anaham Trikavedanam. So whenever, this is from I think Susruta Nidanam, wherein we could see, you know, whenever there is Trikavedanam, Kritsra Mutra Purishatvam Anaham, along with Antra Pujanam, Nabhi Shulam, it indicates Pakvashe Gadavada. So how can we differentiate Amashe Gadavada and Pakvashe Gadavada? You could see there Hridgraham, Parshvedana, Moha, Murcha. Clinically we could see patient coming up suddenly having palpitation, or they just try, they just faint, or kind of thing will be there. So naturally when we ask about them, it would be, you know, after food, maybe 2.5 hours, that might have been a possibility. Then they have this vomiting sensation in the background and all. But with respect to Pakvashaya, the issues will be like Trikavedana, Kritsra Mutra Purishatvam, Shulam Nabhi, Antra Kujam. So imminent Lakshanas are Antra Kujam, Shulam Nabhi, but Trika Prishta Katigraham will be chronic, Kritsra Mutra Purishatvam will be over a period. So that is our specific lakshanas told for Pakvashe Gata Vata lakshanas. So there again you could see he has given us direct indication Sneha Virechanam, Pakvashe Gate. Then Shodhaniya Pasti, also for Prashaha Lavanottara. Any Prasha prepared predominantly from lavana can be administered. So I feel this is again clinically very relevant. Here we have very common practice of giving Eranda Thailam. Okay. So we give Nirgundi Erandam or Gandharva Erandam. It is a Sneha Virechana. Annado Vigune Apane. So just before dinner or just before breakfast, either with Abhayarishtam or with the Chirvilvadi Kashayam or Gandharvastadi Kashayam, whenever we have a Lobake case. And most Lobake case will be having Kritsra Purishatvam, Kritsra Mutratvam, etc. So there, whenever you could see Trikagraham, with then Kritsra Mutra Purishatvam, Antragujanam, Nabhi Shulam, we must visualize Pakvashya Gadavada, and the first line of treatment would be Sneha Virechanam. And in that perspective, Eranda Thailam is the common thing in use, even though in our text we could see the utility of Tilvaka Gratham mentioned at various places. Okay, so I personally have always felt that we must revamp the use of Tilvaka Gratham in practice. So I'm planning for that. So I've already planned for making it, even though it's quite difficult to make with all those dravya. But still, I think that practice we need to revamp anyway. So Sneha Virechanam and then Shodhaniya Vasti and Lavana Prashaha. So there, again, you could see when Delhana's commentary, Pakvashyagata Vayoho Chikitsa Mahaha Pakvashetyadihi Sneha Virechanam Tilvaka Sarpiradihi Virechanam. So there also he specifically says Sneha Virechanam means it is Tilvaka Sarpiradi Virechanam. Vastayaha Shodhaniyaschaiti Shodhana Dravya Nishkwataha Tat Kalka Sneha Samyutaha. So he gives us an idea. It is not just Shodhaniyascha Vastayaha, Vasti that are Shodhaniya in Nasya, in nature. How can we understand Shodhaniya Vasti? Shodhana Dravya Nishkwataha Tat Kalka Sneha Samyutaha. So Kashaya made out of Shodhana Dravya and Sneha Samyutaha Kalka. Sneha that is prepared by using Kalka of Shodhana Dravya, etc. So that has to be included for Shodhaniya Vasti as mentioned in Chikitsa Sthana. Then he says Prashasta Lavanottara iti Sneha Lavana Kalyanaka Lavanadayaha. So the Kalyanaka Lavanadayaha, which is mentioned at the end of the same chapter, it is a special preparation wherein Lavana along with many Snigdha Dravyas are added. Okay, so Kalyanaka Lavanadayaha has been told. So that is included for Prashasta Lavanottara. Anyetu Prashyanta iti Prasha Ahara Natu Lehyaha. So other says, he gives us an idea that Prashayanta means like Ahara, na Lehyaha, not licking, like Ahara only we have to use. Lavanottara Prasha means Ahara that is with Lavana Uttara. Okay, Lavana Pradhana. Now Acharya Gaidas says, Pakvashayaha punarihaha vividaha pittavadashaya bedena. Tado madhye pittashayagate vayo sneha virechanam tilvaka siddham eranda tailadibihi va. Vatashayagatasya tu vayoho malakafa pittaihi avritasya yatha dosham kashaya kalka sneha vastayaha. Tatra malavrita vayoho Vidari Kalka Siddha Sneha Yukto Vyakta Ushna Ksharascha Vastihi Shleshmavrita Vayoho Vyakta Kshara Ushna Vastihi Tivritadi Dravya Mutra Vidari Kalka Siddhaha Pittavrite Punaha Kshara Vastihi Shitaha Shesham Samam. So here again it is a very clinically practiced point that he highlights. Gairasen says about Pakvashya can be divided into, when he says Pakvashya Gate Chapi, speaks about Sneha Virechanam and Vasti Shodhaniya. Pakvashya can be divided into two, Pitta Vatashaya. Pitta part of the Pakvashya and Vata dominant part of the Pakvashya. I think it is very relevant clinically also. So Tayoho Madhye Pittashya Gate Vatao. Among that, Pittashagata Vayu, you have to think of Sneha Virechanam. That can include Tilvaka Siddham, Eranda Thailam, as we mentioned. The downer part, the lower part, which is Vatashagatasyaha, Vayoho that Vatashya Vayu can be Malavrita, Kafavrita, Pittavrita. So Yatha Dosham Kashaya Kalka Snehavastayah. For Malavrita, Kalka Snehavastayah. So Kashaya Kalka Snehavastayah. Tatra Malavrita Vayo Vidari Kalka Sriddhaha Snehayuktov. If it is Malavrita Vayo, you have to use Sneha, which is processed with Vidari Kalka Siddhaha. Vyakta Ushna Ksharascha Vastihi. If it is Shleshmavrita Vayo, Vyakta Kshara Ushna Vastihi, we need not include Vidari Kalka Siddha Sneha. It can be Kshara and Ushna Vasti. And Pittavrita Punaha Akshara Vastihi. So if it is Pittavasta, Kshara should not be there. It has to be Shitaha. Shesham can be. So I think this is a very clinically relevant point. When we have patient coming to us with Antrakojanam, Trikavedana, Mala Mutra Baddham, we have to again divide it into Pitta, Pakvashya, which is more of Pitta, like near Grahani, along with the Grahani, that is Pittashya, lower part Pakvashya. That Vata dominant Pakvashya part can be having Avarana with the Mala, can be having Avarana with the Kapha, can be having Avarana with the Pitta. How will we identify that? Lakshanas only, I think. So if like Pitta dominant near Lakshanas, like some burning sensation or uses or issues more during Pitta Kala or during the time of digestion, but the patient is presenting with Antrakujanam, Nabhi Shulam, Kritsramutra Purishatvam at that particular point, then we definitely have to think of Sneha Virechanam only. Okay, and if it is lower part, then we have to think of lower part in the sense there is no Nabhi Shula. The more it is Trikagraham, along with Mutra Shakrat Graham, Trika pain, no Nabhi related issue, and the time is not after food or lot of with after having food and all, it is in the Vata Kala. In that thing, again, we have to assess whether it is Malavrita, Kafavrita, Pittavrita. Again, how will we practically assess it? If Kafavrita, heaviness will be there. Pittavrita, some kind of Daha he may have, which we have to identify clinically. Malavrita, there will be Mala. So he may pass more of flatness during that time. So these things can be understood as Malavrita. So again, he gives us an idea if it is Malavrita, if it is Kafavrita, and if it is Pittavrita. So if Malavrita, you go for Sneha Dravyas, for Vasti. Okay. So like he gives us a Vidaryadi Ganam. I think almost similarly Pipilyadi Anuvasana Tailam can be contemporarily used, or we have to prepare some Brahmana Tailas like Vidaryadi. Then he gives us, if it is Kapha, you have to go for Ushna Kshara Vastis. So practically, I think somewhere similar to Dhanyamlam with the Kshara, or somewhere similar to you can use, we use Yavaksharam Vaishwanra Churnam with Amrutotram Kashayam. So that can be a possibility. If Pitta dominant, it has to be Shita. So naturally, Punaraha without Kshara, Shita, some Kshira material can be used. So I think these two understanding we have to be having with the clarity. So I think this point is very clinically relevant. So to correct Pakvashya, this can be used for both acute as well as chronic cases. I think in clinical, so recently we had a Pakshagatam case who was not passing motion for 3-4 days. We had given, but now when I was reading this part again, I could realize he was having more Pitta. We had given Pipilyadi Anuvasnam. The initial I gave Gandharvastadi Vaishwanra Churnam. He passed, but again it was tight. So next day Pipilyadi, 2 days Pipilyadi. Then again this were done again alternatively, and 1 day with the Kshira. So when this was done, he is now much better. So even though the patient was having Pakshagada, but at that particular point, we had to correct that particular issue, and he had all these Lakshanas of Nabhi Vedana he was having. Then he was having Antrakujanam, he was having Trika Vedana, he was having Kritsramutra Purishatvam. So this clinical aspect, I think, is very relevant to understand Pakvashya Gadavada in 2 parts. The Pitta dominant, higher part of Pakvashaya, where Sneha Virechanam can be included, and the Vata dominant lower part of Pakvashaya, where Shodhana Vasti can be practiced, and that also we can divide it into Malavarana, Kafavarana, Pittavarana. If Malavarana, Snigdhavasti can be done, Kafavarana, Ksharavasti can be done, Pittavarana, Kshita Vasti can be done. Okay, so that is very important. Now moving on to the next shloka, that is then, so from Amashaya, Pakvashaya, clinically he speaks about Vastigate. So, Vastigate Vate. So, Acharya, even though there, he does not speak about Vastigata Vata. Lakshanas are not there in Nidanasthana. After that, he speaks about after Pakvashagata Vada Lakshanas. In Nidanasthana, Susruta speaks about the Indriya Gata Vata Lakshanas only. So, anyway, Karya Vastigate Chapi Vidihi कार्यो वस्तिगते चापि विधिः वस्तिशोधनः वस्तिगतस्य वायोः चिकित्सितमाहः कार्य इत्यादि. What is that कार्य? वस्तिविशोधनः विधिः इति अश्मिरी चिकित्सोक्तो मूत्राघाताद्युक्तश्च. So he gives us an idea about if vastigata vayu is there specifically, then the treatment protocol that is mentioned in Ashmiri Chikitsa have to be practiced. So he doesn't give us an idea of whether to do Virechana, Avagaha, nothing. He gives us, Ashmiri Chikitsa that is explained, that has to be practiced. Ashmari kind Mutragada Chikitsa has to be practiced when Vastigata Vata Lakshanas are there. So we must understand when Vata, Amashyagata Vata, Pakvashyagata Vata, and then, so I think Pakvashyagata Vata Lakshanas, Pakvashyagata Vata is actually a pathological samprapti. Today's Pakvashyagata Vata we can see, I think, over a period, even if we see Parkinson's case, assess Parkinson's case today, we could see Pakvashyagata Vata Lakshanas in him 10 or 15 years back. Every severe thing that can be included under Vatavyadhi, whether it is a neurodegenerative issue, whether it is a complication kind of marma ghata lakshanas or pakshaghata, whether it is a severe sciatica, all these things, definitely I think we can see the Pakvashyagata Vata Lakshanas in them at least 10 to 15 years before. So that Pakvashyagata Vata Lakshana today may present as sciatica, and further if the Samprapti moves, etc., then more Vyana Vayu, Prana specific Nidanas move up, they can come down to Kafavrata Vyana, Kafavrata Prana, which can later become a Parkinson's. Rather, we understand the Samprapti of Parkinson's in that spectrum only, which later can become an MND or which later can become a polyneuromyopathy. All these things are possibilities. So, Pakvashyagata Vata is actually a pathological samprapti that actually can lead to anything in future in the neurodegenerative or the central nervous system kind of disorders, which generally can be seen in our the spectrum of Vatavyadhi. Okay. So then moving on, he in one sentence he says, Srotadishu prakupite karyaha cha anilaha kramaha. So if Srotadishu prakupite, so what is Srotadishu prakupite? In Nidanasthana he says, Srotadishu indriya vadham kuryat krudham samiranaha. So if there is Srotadishu, there is Shrotradi is actually all the Shrotradi is nothing other than all the five sense organs comes under. So it is Indriya Vadham, he says. So what is actually the whole Indriya has got Indriya Buddhi, Indriya Dravya, Indriya Dashtanam, etc. Only then we have the Jnana Utpatti Krama. So we could see Indriyas functioning getting affected because of Vata in each Indriya. So that is Shrotadishu. There again in the commentary we could see Shrotadishu prakupita vayaha chikitsaha shrotre adi shabdaha tvak grana jihva netrani indriyani grihyante atra kramaha snehaha sveda tada abhyangaha ityadikaha dosha dosha pratyaniko yatha yatham karyaha. So when he says anilaha kramaha, that means sneha, sveda, abhyanga, etc. And then dosha dusha pratyaniko yathayatham karyaha sa cha indriya satmyam apekshya kartavyaha tena sneha shabda samanyeti netrayoho ksheerasarpihi tarpanaha taila tarpanam punaha karnadishu iti. So he says when karyaha anilaha kramaha, that kramaha word indicates sneha, sveda, abhyanga, etc. with specificity towards the included or affected dosha dusha pratyanika yathayatham karyaha. And then sneha shabda, when it is used, we have to be understanding not only the samanya but specific to netra, like shira sarpitarpanam of netra, taila tarpanam karnadishu api. Okay, so when indriya vadha or any of the senses are affected, all the 5 senses are affected, the general Vatavyadhi things, anilaha kriya krama we have to do, which he is explaining in the next coming shlokas. Okay. Then next he speaks sneha, abhyanga, upanaha, mardana, alepanani cha twang mamsa asruk sira prapte kuryad cha asruk vimokshanam. So there abhyanga with sneha abhyanga, then upanaha, then mardana means actually having some pressure. Okay, alepana is definitely having covering. Okay, that is alepana. Is the line, is the treatment modality when twakka, mamsa, asrak and sira are affected, and cha kuryad cha asrak vimokshanam. So and that can be included and add on asrak vimokshanam, rakta mokshanam can also be done. So throughout this, what I could see when compared to charaka, sangraha, hridaya, many places, I think Sushruta, being a surgeon, has always been dealing with rakta, and he could see the involvement of rakta in all Vatavyadhis. And that is why in wherever treatment modalities are there, rakta mokshana has been included as a treatment modality for Vatavyadhi. Like sneha, abhyanga, upanaha, mardana, alepana is actually followed by asrak vimokshanam. And you could see this asrak vimokshanam or rakta mokshanam mentioned at various places at various contexts. So in the commentary again we could see that dhatu upadhatu gatasya vayoho chikitsa maha sneha ityadihi. So there he speaks about the chikitsa of dhatu and upadhatu, sneha, abhyanga, upanahascha ityatra. Delhana's commentary, chakarena tvagata vayoho hridyam api annapanam anuktam samuchiyate. So when he says sneha, abhyanga, upanaha, mardana, alepanani cha, the cha includes, it's not just only external things like sneha, abhyanga, upanaha, but also hridyam api annapanam. So the internal usage of annapanam that are hridyam in nature are also very relevant in case of treating twak mamsa asruk sira prapte. And then twaggatra rasaha siraha punaha asraja upadhatuhu. That is why sira, whenever sira snayu sankochya, sira is actually upadhatu from rakta only. Praptehe gate ityatra. So we could see twaggada, sira, punaha, asraja, those things affecting rasa and rakta. Raktagato vayau raktasravo raktadishthanam vataha nivrittityartaha. So whenever vayu is afflicting raktagata, it indicates indicates or it gives us an option of going for rakta mokshana. That is why raktadisthana vada nivrityatram raktasrava has been told. Yatha dravya prabhava visheshena kharjura matulunga sauvarchaladi sneha abhyangadibihi prashmeti tada niyamena raktavaranam parignyaya raktamokshanam kartavyam na punaha anyata. So there he says, see, yatha tada niyamena raktavaranam. If you understand raktavaranam to be the part of the samprapti of the Vatavyadhi, only then you go for rakta mokshanam. not otherwise. So you have, because we know Raktam is actually that which causes Jivanam. So when Rakta and Rasa, that is Priyanam in our body, when there is Rasakshaya, Raktakshaya, that itself will lead to the aggravation of Vata. So there, in that context, we have to be very specifically understanding. If we are not clear on Raktavritatvam in the Samprapti, you must not go for Raktamokshana. Because if it is done in a wrong place, that itself will cause aggravation of Vata. Okay, so Yatha Dravya Prabhava Visheshena Kharjura Matulanga Savarchaladi Snehabhyanga Dibihi Na Prashmameti Tada Niyamena Raktavaranam Parignyaya Raktamokshanam Kartavya. So as we all know, when Rakta has to be understood. When Ruksha, Snigdha, Ushna, Shita, all these treatment don't respond to the patient, then we have to think of Rakta's involvement. So if for Dravya Prabhava Visheshas, Kharjura, Matulanga, Savarchaladi has got no effect on the Vata issue. Sneha Abhyanga also does not cause any relief of the Vata issue. Then we can think of Raktavaranam. And only when you are specific about Raktavaranam, you think of Raktamokshanam. Otherwise, you should not go. Then Medogate Punaha Iha Anile Chikitsa no Upadishta Tasya Sneha Vishayatvena Vatavyadhi Karmanam Avishayatwad Mahavatavyadau Punaravarana Prasangena Medogatam Anilam Bakshyati. So there in the shlokam, Acharya has restricted Tvak Mamsa Asrak Sira Prapte. He has not gone for Medovada. Then Delhana says why he has not explained Medogata. Because since in Medogata Vata, Sneha Kriyakramas are not directly indicated. It is out of the purview of Sneha Vishaya. That is why here in Vatavyadhi it is not included. Rather, when we move from Vatavyadhi to Mahavatavyadhi Chikitsa, in the context of Avarna and all, Acharyas include about Medogata Anila there, and he has skipped or not specific regarding Medogata Vata in this context. Okay. So till now, I think if you need any clarification, you may ask then, otherwise we'll proceed further. Okay, so I think if no specific question, then we'll just move on with the next coming shlokas. Then, from Tvak Mamsa Asrak Sira Prapte, then Acharya gives, continues the thing on Snayu Sandhi Asti Samprapti. Okay, so where, you could see Snayu, then we could see actually Snayus related with Medas. Sandhi, which is actually formed from, Sandhi is actually a part of our Madhyama Roga Marga. Shiro, Hridaya, Basthyadi, Marmanya, Asthanam cha Sandayaha. So Sandhi, which is actually Tanni Baddha Sira Snayu. So Sandhis are that is formed from the Astis, Astayaha, and there are Sira Snayu that cause Bandhana to Sandhis. So you could see in the context evolved organs, specifically told here from dhatus to the evolved organs, like snayu, sandhi, asti, samprapte. So if the samprapti is with respect to snayu, sandhi, asti. So again, he does not directly mentions about dhatus of medas, asti here, but he speaks about those evolved avayavas that will have afflictions of Vatavyaya. Snayu, which is again, this Upadatu from Medas, Snayu, Sandhi, Asti. If the Samprapti is there, Sneha, Upanaha, Agni Karma, Bandhana, Unmardana has to be the part. So when we say Unmardana, it is not just Mardana. For Tvak Mamsa Asraka, it is just Mardana. But here when it comes to Snayu Sandhi Sira Papte, it is Unmardana, Utkarshena Mardana. Okay. So there, snehana as upanaha. So what is upanaha is actually bandhanaha. Then specific agni karma is mentioned. Then separate bandhana. Bandhana means just bandaging. Upanaha is bandaging with special dravyas, a combination of dravyas. Then unmardana, pressure, application of more of pressure. If snayu sandhi and asti samprapti. So here, why a higher note of treatment modality is told us, we have to understand it as the affliction of vayu is at on a higher level. It is like working at the level of evolved avayavas. The affliction will be on a deeper note. So there also Delhana in his commentary says, Snayugatasya Sandhi Astigatasya cha Vayo Chikitsa Mahaha Sneha Ityadihi. Sneha means Bahya and Abhyantara. Atandritaha means Analasaha. That is why Kuryad Vayoho Atandritaha. So people who are Analasaha after Vayu's affliction, they have to think of Sneha Upanaha Agni Karma Bandhana. Then Etena Chirakalam Nirantaram Kriyeti Darshayati. So, when it says these diseases happens chirakalam nirantaram kriyeti darshayati. So it happens chronically and it gets on afflicted again and again. So it needs a continuous management at different levels. That is why he speaks in that context. Okay. Now next, he speaks about, whenever I read this shloka, I visualize the different issues, probably in a period when there was yuddhas among people. Every country maintained their own, every place, every small, what do you call it, as a place had their own armies. They were fighting. That is why yuddha dehi. You could see in many nidanas, you could see yuddha dehi. In Anagneya Sveda, we could see ahava, buripanam, krodha, though that. So there also there is yuddha. So yuddha, fighting was always a part of our of the social situation there. There in that context, the next shloka comes wherein he speaks about Vayu, if there is a specific affliction with respect to Vayu in Asthi. So, Niruddhe Astaniva Vayau Panimantena Darite Nadin Dattva Asthani Bishak Chushayet Pavanam Bali. So there, if we find Niruddhe Vayu in Asthani, okay, then Panimanthena Darite, then you have to, what do you call it as Panimanthena Darite, Nadim Dattva. You manipulate the Asti with your hands in a way that you put a nadi, a tube with both ends open into the Asti and Chushayet Pavanam Bali. And just you suck the Pavanam Vayu out of it actually. So I always used to wonder how this might have happened, how to do this actually. So I think some acute injury to the bone, probably that could have been a possibility, but anyway I couldn't identify the exact. I had even inquired with Shallim people exact methodology of how this might have done. Anyway, so when there is a Vayu Koba in Asti, then the area around that has to be cut open, and then you have to insert a tube, and then you have to suck out the air from it, so that the Vayu is corrected. So you need a very physically strong person to do that kind of what you call it as holding and all towards the Asti. Okay, so that has to be a possibility. There, again, you could see Dalhana saying Astani gate majjasthe cha karma nirdashanaha. If it's Asti and majjastha niruddhe ityadihi, what should be done? Tongmamsa shastrena vipathya. So using a shastra, you do vipadanam to tongmamsa, you cut open it. Asti panimantena ara shastrena vidha. Then you use your hands and use Ara Shastra to cut open the Asti. Tatra Randre, in that you open, in that opening you use a Dvimukhi Nadi, Mukha Maruta Chushanena, Pavanapakarsanam Karaniyam iti. So you open up the skin and you put a hole in your, somewhere like how we are actually doing a bone marrow testing today. Okay. So maybe that is the way bone marrow is done through needling through the bone, no? So maybe that is, the similar method he tells us to be used for Asti Majjagata Vata. You do it and then you suck the air out of it. Okay. Mukhamaruta chushanena pavanapakarshanam karaniyamiti. And then he says, Chushayed pavanam bali. So bali means balayuktaha. So physician has to be, I think, bali, as well as the rogi must also be bali. Bahyabhyantara snehaishta ityadi kechit patayanti. Some others say Bahyabhantara sneha. Tatra Bahya sneha parisheka avagaha abhyanga mastishka shirovastyadihi. Abhyantarastu panavastyadihi. Asya pathasya bhavas nirnayo na kritaha. So I am not for it, but some other patha in Asti Majjagata Vata, Bahya Abhyantara Sneha has been told. We could see, Delhana writes after Ashtanga Sangraham there and all. For Asti Majjagata, Bahya Abhyantara Pata only it is included as such. Okay. Then the next shloka comes about Shukra Prapte Anile Kare Shukra Dosha Chikitsitam. So Shukra Gatasya Vayoho Chikitsa Mahaha Shukra Ityadihi Shukra Dosha Chikitsitam iti Shukra Shonita Shuddhi Yuktam Chikitsitam. So that is like Vajikarana Uktam, Mutra Dosha Chikitsa Uktam. So whenever Shukra Vajikarana, Shukragata Chikitsa it is told, Vajikarana Chikitsa can be included. Also the Mutra Dosha Chikitsa can be used. That is why Teshwadyan Shukra Doshadin it has been told. So Shukra Prapte Anile Karye Shukra Dosha Chikitsidam. So we could see from Amashe Gadavada, Pakwashe Gadavada, then Vasti Gadavada, then Indriya Gadavada. Then he gives us idea of Tvakka, Mamsa, Astrak, Majja, Asti, then up to Shukra. So from Amashaya, Pakwashe Gadavada to Dhatu Gadavada. Then from there we could see how we are moving on towards the further treatment of Vatavyadhi in general, which has been mentioned. Okay. So Avagaha Kuti Karshu Prastara Abhyanga Vastibihi Jayet Sarvangajam Vadam Tiramokshaischa Buddhiman Ekangajam cha Matiman Shringaihi cha Avasthitam Jayet. So here he says for Sarvangaja Vata Lakshanas. So Sarvangaja Vata Lakshanas. So
Hello, ma'am.
yeah. So Acharya Susrutas mentioned about the context of Sarvanga Vata with Lakshanas of Hastapada Shiro Dhatu Tada Sanjariti Kramat Vapnyavadas Akhilam Deham Vayu Sarvagatunranam from Susruta Nidana Sthanam. So there, in that context, so Lakshanas are Stambana, Akshepana, Swapa, Shofa, Shula. So you could see in Snayu Gata Vayu Lakshana, Snayu Praptaha, Stamba, Kampa, Shula, Akshepanam Tada. So whenever there is a Stamba, Kampa, Akshepana, Snayu has to be understood in the background of Samprapti. Sandhi, Shula, Shofa, Sandhi Gata Vata Vino. Asti Gata Vata, Asti Shosha, Beda, Shulam, there is there. And in Majjagadavada, there is ruk continuously, he says. Okay, Majjagade rukchana kadachit prashamyate. So whenever a patient presents with pain that is continuous, it cannot be subsided at any point of time. Continuous pain means Majjagadavada. Okay, so Sarvanga Vada means affecting all the dhatus at different levels. The patient will present with Samba, Akshepa, Swapa, etc. In that context, we can think of Avagaha, Kuti, Karshu, Prastara, Abhyanga, Vastibihi. So, Sira Moksha, as I mentioned, Shruta always more speaks about Sira Mokshana. Then Ekangajam ta Matiman Shringaischa Avasthitam Jayeta. Matiman Vaidya in Ekangagavada. Shringaischa avasthitam jayet. According to avastha, shringa can be used over there. So there again, Aruna means Delhana's commentary gives us more clarity. Okay. So what is that clarity? Dhatu upadatu gatam abhidaya sarvanga gatasya vayoho chikitsa mahaha avagaha ityadihi. What is avagaha? Vadahara purna droni adishu avagaho dravasvedaha. Then what is Kuti Svedam? Kuti is Chaturdwara Bhuma Avarota Avanita Vidhum Angara Vadaharat Avasikta Sachoshma Svedaha. Kuti, Karshu, Prastara are all different types of Ushma Svedas. In Kuti, where there is a thing, a hut-like kind of thing with the openings, and there are things burnt inside, and the heat is made, the person is made to lie inside, and the heat is felt. The patient is made to have the heat from the agara. Karshu is, Purusha Yama Matra Nikhata Dagdava Nipradesha Vadahara Drava Sikte Shayanam. So like Karshu therein, according to the size of the Purusha Yama Matra Yama Nisvata Dagdavani Pradeshe. So, there is a big tunnel, like the patient's size, it is dug and he is made Vadahara Dravya. It is poured with Vadahara Drava. Then Vadahara Dravya is then Vadahara Dravya. Water is poured, the Vadahara Dravya. Okay. Drava made out of Vadahara Dravya is poured over that slab, and the patient is made to sit and have to, is advised to have the steam from this thing. That is Karshu Sveda. So it is all coming under the 13 types of Sveda told by Charaka. And then are we practicing it now exactly? We're not practicing it in exact format, but we can use the different kind of there's Lepana, different kind of Pindas Vedas. There are different modalities of using Pindas Vedas also as modifications to this Karshu, etc. Okay. Then Svinna Tushadhanyadibihi Stritiyam Bhumau Parishanam Prastaraha. So, like when the bhumi, that the slab or an opening is covered with dhanyadihi, etc., different poultices, and then the patient is made to lie over there. It is called as prastaraha. So that is also saha api choshma sveda vishesha. So these are actually, what are these svedas? Are actually different modalities of giving heat. Some are maybe out of conduction, convection, radiation. The three modalities of expressing, or the three modalities of giving heat. What our acharyas have done is utilizing the materials in and around available. So that is Vatahara. At the same time, we are regulatedly giving ushnatvam to the body in a very regulated way. So when we do, the quantum of heat that the body receives is different when it comes to prastara, when it comes to karshu, or when it comes to kuti svedam. So according to the bala of the patient and how much the dosha and dhatu involvement is there, I think these are the variables that decide which kind of sveda has to be done. Ushma sveda is meant for vata plus plus kapha plus. Upanaha vata plus plus. Drava for vata anubandhatvam with the pitta. That is for drava. And then upanaha is again vata plus plus. Tapas sveda, which is exclusively dry, kapha plus plus vata plus. So according to situation, he advises us to be used. Sneha Purva Avagaha. He says Avagaha, that means we must understand the Sneha Purva. Etecha Sarvanga Gate Vate, Sarvanga Yoginaha, Upanaha Svedastu Avayavage Api Vatehe. According to Avayava, Upanaha Sveda can be used. Tapas Svedastu Atra Rukshatvad Yuktaha Eva. Tapas Sveda, which is Rukshatva, can be used. Yadyapi Sarvanga Go Vata Prakopa. Yadyapi Sarvangagaha Vata Prakopaha. प्रायोः धातुक्षय निमित्तः तथापि शोणिताधिष्ठानत्वाद् रक्तमोक्षणोऽपि युक्तः. So वातप्रकोप प्रायोः धातुक्षय निमित्तः. If वातप्रकोप is due to धातुक्षय प्रायः, तदापि there also if shonitadhishthanatvad, shonitadhisthana we could understand, then raktamokshanam can be a possibility. That is why siramoksha it has been told. Siramoksha iti bahuvachanad panjanam siranam mokshanam snehadi aprashamyanti vate. So snehadibihi used and it is not causing any prashamana, aprashamyanti, then the word sira mokshaihi it has been told, like it is a plural word. It is not just told sira moksham buddhiman, shira mokshaischa buddhiman, shringaischa. That means more than one time, more than one sira we must understand. So we must just understand that we must be doing it repeatedly according to the situation in Sarvangavadam. So that is the indication that he gives us sira mokshaischa buddhiman. Okay. Now then moving on. Balasa pitta raktestu samsrishta avirodhibihi. Now if there is samsarga of vata with balasa, pitta or rakta, you have to indulge in things that does not cause problem to balasa, avirodhibihi. That is why. That means if there is kaphanubandhatvam in vata, you do just not too much of ushna. It has to be ruksha, mid ushna. So your ushnatvam should not be very high that it causes kapha vilayana. So you must understand the doshas involved. If pittanubandha vada, you must not go for too much of pinda sveda or ushna, things with more of mardana. Pitta cannot tolerate mardanam. So it has to be drava sveda. So like that, you have to be understanding the balasa pitta rakta is to utility. Moving on to the next shlokam. Suktivate twang asrak moksham kuryatu bahushaha bhishak dihyacha lavanagara dhumehi taila samanvite. So I think this is next few shlokas I have always clinically more seen and practiced areas. So see, whenever Sukti Vatam is there, Twang Mokshanam Kuryat. So if Sukti Vatam is there, Twak Mokshanam, Twang Asrak Moksham Kuryat. How Bahusha Brother? You must do Asrak Mokshanam Bahushaha many times. Also, you can use apply Lavana Agara Dhumehi Taila Samanvite. You can use Lavana Agara Dhumehi Taila Samanvita. You can apply Agara Dhumam and you can apply Taila Samanvitam. So that is the possibility. So, when we say that is Agara Dhumam. Agara Dhumam means that what you call it as Dhuma that is available from a Agara, like big houses or big rooms where things are burnt. We will be getting the smoky dust, that is Agara Dhuma. Then, Dihyacha lavanagara dhumaihi taila samanvitehi, and added with oil. Okay, added with taila. Okay, taila can be added with lavana, agara dhuma, etc. So see the commentary. He gives us important clinical things. Raktavritasya vayu chikitsa sukti ityadihi. So Raktavrita vayu he says Raktavarana kritaya suktya lakshito vataha asukti vataha. So whenever there is Sukti, Raktavarana Vata. And what is Sukti? Dalhana says Sparsha Ajnanam. Okay, so for us Sukti is very specific. Sensory loss is Sukti. Sparsha Ajnanam. So the touch will not be understood properly. So in that context, I have always felt numbness, tingling sensation, lack of touch, all altered sensations, everything can be considered under Sukti because it is specifically told Sparsha Ajnanam. It is not just a touch, the improper touch also. Okay, so Sukti, Sparsha Ajnanam, not having proper jnana of Sparsha. पुनः रसावरणकृतया सुप्तया लक्षितो वादः तस्य स्नेहोपनादिः विषयत्वाद्. So if it was rasavarana, sneha upanaha etc. has to be considered. Anyadhatukade vayu raktabhagarshanaasya yuktatvad. In anyadhatukada vayu also raktabhagarshanam may not be utilized. But here it is Raktavaranam present because of Sparshajnanatvam indicated by Sukti. Bahushaha Varan Alpalpam Sravanad. So Bahushaha Bishak he says Bahun Varan Alpalpam. At a time too much should not be there. At a time too much if we do Raktamokshana, it itself cause Vatakopa. So little again and again we have to do Anyatha Vatakopahasya. That is why Anyatha Vatakopaha it has been told. Now, Dihyada cha. Dihyada, the word, Acharya says it as lepayet. That is indicated by lepana. Anyetu suktato dihya. Do lepana with lavanagara dhumaihi taila samanvite. Taila processed with lavanagara dhuma or taila with lavana agara dhuma. Both this is understood. Anyetu suktavata tvagata vataha. Vaivaranam suranam rauchyam suktim chumuchumayanam. So Vaivaranam, Swaranam, Rauksham, Suktim, Chumuchumayanam are the indications for Suktavada. Tesha mate Tvang Mamsa Ityadinaha Praguktam api Shonata Mokshamiha Punaha Uktaha. In their understanding, here Tvak and Mamsa both are involved. So it is again, since it is already told, again Raktamokshana is told here. Then Lavanagara Dhumaihi Ityadi Pradehaha Adhika Uktaha. So he adding on to that, along with Raktamokshana, which is already told, Pradeha, Lavanagara, Dhumaihi. So Lavanagara, Dhumaihi, Ityadihi, Pradeha. So Pradeha, external application of Lavana, Agara, Dhuma, Taila, Samanvite. So Taila, which is added with Lavana and Agara, Dhuma, is interpreted as more. So practically, we practice Tilataila, just you heat Tilataila with Kallupa. Kallupa means this rock salt at home and then apply externally whenever they say loss of sensation in specific areas. This we commonly practice. I think this comes from this understanding. Agara Dhumaihi, that I have not clinically utilized too much, but Lavana and Taila is very commonly used. Then the next shloka is Panchamuli Shrutam Kshiram Phalamlo Rasa Evacha Suksnigdaha Dhyana Yushava Hita Vatavikarana. So from Svarvanga Vadam to Sukti Vadam, then for general Vatavikara, see you can use Panchamuli Shrutam Kshiram. So all Panchamula, Dashamula Kshiram, Panchamula Kshiram. We commonly use Bruhat Panchamula, Lagubanya. Commonly used one is Dashamulam only. Kshiram, Dashamulam is used internally, Dashamulam is used externally. Phala Amla Rasa Evacha. Amla Phala Rasa and Mamsa Rasa. Susnigdaha Dhanya Yusha, which is Susnigdha Va, alternative. So these are all options which are Hita for Vatavikarana. So coming to the commentary, we could see Sarva Vatavikarinam Bhojananyaha Panchamuli Ityadi Panchamuli Adyaha Dvitiya Va Falaihi Dadimadibihi Amlaha. So what is Amla Phala? It indicates Dadimadi Phala. Rasa is Mamsa Rasa. Dhanya Yusha is Kulattadi Vatahara Dhanya Yushaha. Susnigdha Shabdaha Yusha Rasabhyam Saha Sambandhyate. Okay. So Susnigdha Shabdaha Yusha Raso. Susnigdha, that word we must understand. Yusha Rasa Saha Sambandhyate. So Dhanya Yusha, which is Susnigdha. So dosha prakriti satmyapekshaya kshiradi prayogyam. So you can use susnigdha means according to dosha prakriti satmya, very clinically relevant. Because in Kerala, many times when we give kanji, which is a common thing in our treatment protocol, many people, especially who are from out of state, they cannot have kanji at all. Okay, kanji means it is our rice gruel, they cannot have it and they vomit and all. So the satmyata is very important and dosha prakriti is also important. So according to the satmyata and all, you can use kshiradi prayojam, vadibhyaha bhojanam hitam. So according to, he gives us an option of how all possibilities we can think of. Okay. Now the next important thing is about the upanaha, salvana upanaha, kakolyadigana, which we are very commonly using in Vatavyadhi. So काकोल्यादिहि सवादग्नः सर्व अम्लद्रव्य संयुतः स आनूप औदक मांसस्तु सर्व स्नेह समन्वितः सुखोष्णः स्पष्टलवणः साल्वणः परिकीर्तितः तेन उपनाहं कुर्वेद सर्वदा वातरोगिणम्. Here we have very common practice there are some traditional schools who practice upanaham in all Vatavyadhi, whether it is Pakshagada. They do after every treatment, every evening, they do upanaham in lower limb and upper limb if it is affected Pakshagata, or if low backache in the low back region. So their treatment protocol itself, you do any process in the morning, whether Vasti, external procedure, Ushma, Sweda, Dravasveda, etc. In the evening, that part they will do upanaha. That is a normal protocol. Okay. So काकोल्यादिहि स वादग्नः सर्व अम्लद्रव्ये संयुतः. So upanaha, he says in the commentary, what is kakolyadihi? Kakolyadi. So salvana upanaha it is called. This is salvana ganaha or salvana upanaha, which will have its content as kakolyadi ganam. Then savadagnaha. Savadagnaha iti the commentary says vadagnehi badradarvadihi vidari gandadibihi. Savadagna. So Badradarvadiganam or Vidaryadiganam told in Shodhanadigana and other Susruta space. Sarva Amladravya Samyuta iti Amladravyani Shukta Kanjika Sura Sauviraga Dadi Mastwadini Kechidacharya Evam Vadanti Amladravyani Dadimadini. Some people say Amladravya is Dadima, but Amladravya can be Shukta Kanjika Sura Sauviraga Dadi Mastwadini. We practically use Dhanyamlam. Then we use arikadi, that is amla kanjigam, this rice wash water. We use dadimandam, we call it as tairinda thali. So we use Badradarvadi ganam, which is added with dhanyamlam, sainthavam. Then sarva sneha samanvitam, we use thailam and ghritam together in some cases. If more pitta dominance is there, we add the ghritam also, or only thailam it is added. In thailam, sometimes we use Mahanarayana thailam or we use Pinda thailam kind of things to the dravya. So in that way, Kakolyadi gana is used. Sarva Amladravya Samyuta iti Amladravyani Shukta Kanjiga Saubiraka Dadimastwadini Kechid Acharya Ivanati Amladravyani Dadimadini Anupa Udaka Mamsara Saha Vartate iti Anupa Udaka Mamsa. There we practically use Mamsarasam from goat. We are adding it into the upanaha dravya. Atra anupa shabdo ayam kulachareshu eva vartade audaka shabd. So anupa audaka both are told, no? So anupa means kulachareshu eva. Then audaka shabdena tu koshastaha padinaha matsyasta grihyante. So there are special matsyas that is told here in the text. Anupa shabdo ayam kulachareshu eva. So who are like in marshy, those animals in the marshy area. But we are practically using mamsa from the aja for our kakolyadi vasti. I mean kakolyadi gana upanaha. Ye punaha audaka grahanam na patanti te tu panchaswapi vartayanti. So some people don't take it as audaka or whatever. Okay. So sarva sneha grita taila vasa majjanaste samanvitaha. He says about sarva sneha means all the 4 types of sneha can be used. We practically use grita and taila together. Then sometimes vasa is added, not very commonly used, but vasa is added, especially astigata lakshanas are there, vasa is added to the upanaha. Sukhoshna means ishadushnaha. So whenever sukhoshna we say, it is ishadushnaha. Spashta lavana iti spashtani vektyani saindavadini lavanani yatra sa spashta lavanaha. Spashta lavana means Saindavadini lavanani saspashtaha. So it has to be prominent. Saha Asamantad lavanena vartata iti salvanaha. Since the whole combination is existing along with lavana, it is called as salvana. So practically we use Bhadradarvadi Ganam, Vidaryadi Ganam added with Mamsarasam, Saindhavam, Kakulyadi Ganam, Mahanarayana Thailam according to the condition, Ghritam is added. Then we make it, heat it. First Dhanyamlam or Amlakajam is poured, then Saindhavam is put more. Then powders are added, then Dravadravya is added. Then usually coconut, not coconut, our banana tree leaf is used if we are using a single limb altogether. If joints only, Erandapatra is used. And then we apply oil just to heat the leaves, then apply this paste, and then we paste and cover it in the whole limb, lower limb. If Pakshagadam or kind of Mamsa Shosham, etc., in the lower limb, upper limb means upper limb, like that we add. Okay. So in the commentary, again, he ends with Sahas Asamantad Lavanena iti salvanaha Upanaha Bandhanam. That is why Eshamcha Bhagamanaha Mamsena Atra Aushadam Tulyam Yavata Amlena cha Amlata Tavantascha Chatusneha Snigdhatvam cha Yatha Bhavet. So Chatusneha is added for Snigdhatvam. Dravya Swabhavam Svedya Desham Apyaveksha Kalpane Iteka Vadanti. So according to Setena Upanaha Kurvita Sarvada Vataroginam Dravya Swabhavam Svedesha Smapyaveksha Kalpaneya. So Dravya can be used according to the Svedesha, and according to Desha you can use it. Okay. Then you could see how it has to be applied. Next he says clinically. Kunchyamanam rujarteva gatram stabdhamatapicha. If the gatram is kunchyamanam means you could say in commentary. Tatra siragatena vayuna kuryad siragata shulam sirakunjana puranam. So whenever there is sirakunjanam, ruja, gatram, sthabdam, then you can use this kakolyadigana salvana upanaha. Gadham pattehi nibadniyat kshauma karpasi kaurnikehi. Kshauma karpasi, cotton cloth or silk cloth which is gadham pattehi nibadniyat. Patta made out of shauma, karpasi, etc., which is tied very strongly. Bidala nakulondranam charmagonyam ragasyava praveshedva swabhyaktam salvanena upanahitam. So first it has to be done swabhyakta. If you are unable to tie along with like gade patte dibadniya, you can also use it as a cover. We see nowadays our socks kind of things, which is made out of the skin of Bidala Nakulondrana. Okay. So out of the skin of Bidala Nakula, you can use the Undra. Okay. So you can use Bidala. Bidala is a kind of cat. Nakula is a kind of mongoose. Undra, I think it's a kind of, I've seen it, like understood it to be a kind of deer. Okay, so Undra along with. So anyway, animal once, I think in earlier times when these animals were dying, no, they used baby, but the skin were actually more strong and non-degradable. So that skin was used for these external utility. Okay. So you could see in the commentary, Anagneya Svedam is told, Kunchamanam Sankochamanam Tacha Siragatena Vayuna Kuryat Siragataha Shulam Sirakunchana Puranam Rujartam Vedanartam Atra Pradhanena Vayuna Etena Pitta Raktavrute Vate Bandham Vidihi Nishiddaha. We must understand, if Pitta Raktavrata is there, Bandhana should not be done. Anyetu Valva Karpasi Kaunike. Others say that this Karpasi Kaunike, different type of silk cloth that can be used. Undraha Paniya Bidalaha. Some Bidala that is there in, that is some kind of cat that lives in Paniya, water, I don't know. Sarmagoni Charmaprasikaha Chagaladha. I think that animal specificity it is told. I am not clear about it. Okay. Then, next point is very important clinically. Kanda Vakshas Triga Praptam Vayum Manyagatam Tada Vamanam Hanti Nasyancha praptam, manyagata lakshanas are there. The patient must undergo vayu and vamana and nasya. So we always have a tendency, if neck pain, manyagata skandhas are all involved, we still go for external pudikidi, elekidi kind of things. But Acharya says if that area is involved, for a better cure, you must go for a vamana and then nasya. That should be the point. That is, the commentary says, avayava visheshagate vayoho kriya visheshamaha skandetyadihi vakshaha sanantaralam trikam urdhva trikam. Here the trika indicates the trika in the urdhva, so the neck area. Nasya matra shiro virechanam. Nasya has to be understood as shiro virechanam. Kushalena kriyavida avasthavida vishajetyatra. So, kushalena, that word kushalena prayojitam, that means you must understand avastha vidyanena, you must use either vamana or nasya. So whenever there is jatrurga affliction in the case, we must always think of vamana and nasya. It is not just, I have also experienced that. We always generally have a tendency for admitting the patient and undergoing this external procedures, start with ruksha, patrapotla, Churna Pindasveda, Tapasveda, followed by some Snigdha, Jambira Vindasveda, then Patrapotla Sveda, Shashtiga. But all this will have results, but after 3 to 4 months, again it comes back. Only when you make them undergo Vamana or Nasya, the patient will have issues that is not recurrent again and again. Okay. Then, next shloka speaks about Shirogata Avastha. Shirovastihi Handi Asrag Vimokshanam Sneha Matra Sahasram tu Dare Tatra Yogataha. So in Shirogata, Shirovasti has been told. Also in Shirogata Vada, Asrag Mokshanam has also been told. Sneha Matra Sahasram tu Dare Tatra. So here in Shirovasti, Sneha Dharana, it is told as Matra Sahasram for 1000 Matra. In the commentary, you could see that they discuss why Matra Sahasram, Dasha Matra Sahasram, Dasha Sahasram at all it is told. But he again says Dasha Sahasram. In the last point, you could see Jajjata Gaitu Yogata Itri Yoge Swastha Vratte Matra Sahasra Dharanopadesham Tatra hi Shalakya Kriya Kalpokte Shirovastau Yata Dosha Shadashta Dasha Sahasrani Dharana Matroktam. Na swastasya shirovasti dharana matra tatroktaha. That means in Shiro Shalakya Kalpa, definitely according to the condition, Shad Ashta Dasha Sahasra has to be considered, but otherwise in Swastha Matra Sahasram for Shirovasti can be considered, which is indicated over here. So, when there is Shirogata Vata Lakshanas, again, how we will be understanding about Shirogata Vata Lakshanas. So whenever there is a problem with the, what you call it as, specifically Shirogata Vata Lakshanas, Indriyas, specifically Shirogata Vata Lakshana is not mentioned in the text. But whenever Indriya Vada is there, Shirashula is there, etc. If you understand there is Vata specific to Shirogata, Shirovasti has to be done, or to prevent its moving on to further Samprapti, if it is in Swastha, then simple Shirovasti for Matra Sahasram has to be done. So that is the thing. Okay. Okay. Then, Sarvangagatam Ekangasthidam Vapi Samiranam Runnadhi Kevalo Vastihi Vayu Vegam Ivachalaha. Like Achalaha Vegam Ivaha. Like, like a mountain stops the Vayu in the same way. For Sarvanga Ekanga Anila, Vasti is the ultimate treatment. He gives us a single thing. Okay. Then I think then the last part of the discussion that I would like to discuss is what all things is possible again. In Vatavyadhi chikitsa, he speaks there. Sneha svedaha, tadabhyangaha, vastihi, sneha virechanam, shiro vastihi, shirasnehaha, humaha, snehika evacha, sukhoshnaha, sneha gandushaha, Nasyam Snehikamevacha Rasakshiranni Mamsani Sneha Snehanvitaha cha Bhojanani Phalamlani Snigdani Lavanani cha Sukhoshnaste Parishekas Tada Samvahanani cha. So in the whole spectrum of Vatavyadhi, two things that I always see, Phala Amla use of Amla Phala like the Adima, and use of Lavana internally. Both these things we can take it into a very important thing in our practice. Okay, so we can advise Saindava Lavana to be used differently in different Panjamula Shrutam Kshiram or Panjamula Kashayam. I usually give Dashamula Peya. Boil kanni, means rice, you boil it with Dashamulam, add Lavana and then have it in any Vatavyadhi. In my OP prescription, it will be there. So, different things that we can practice. Shirovasti, Shirasneha, Dhuma Sanika, Kshirani, Mamsa Kshiram, means Kshira, Mamsa Rasa. And always after my, if chronic kind of thing is there, either it is an MND or a Parkinson's, and at that point of time, after IP admission, 3 weeks, I practically go for Mamsa Rasa. I give soup with Ashtavargam Kashayam. But if in Parkinson's, I use goat's brain. If it is MND, I use the legs and hands of goat. Boil in Ashtavargam Kashayam and then have it like soup. This is one of the things that I practice also. Then Kunkuma Agaru Patrani Pushtela Tagarani cha Kausheyarnika Raumani Karpasi Guruni cha. So, the use of Kunkuma Agaru Patrani Pushta Ela Tagarani. Okay. So you could see what you call it as utility of Kunkuma Agaru. The application of Kunkuma, Agaru, Kushta, Ela, etc. And the use of different kind of Kausheya, Arnika, Romani. Romani means, I think, made from the skin or the what do you call it as kind of wool kind of thing, okay, from the wool animals. So that is Romani, Karpasani from the cotton, Guruni, wearing of such cloth, Nivata, Atapayuktani, staying in Nivata and Atapayukta, getting exposed to Atapa, staying in Garbhagraha in closed spaces. Mridvi Shaya, having soft bed, Agni Santapaha, Brahmacharya. So these are all Samasena Vamadini Yojyam Anila Rogishu. So Yojyan. So you according condition Anila Rogishu Samasena. In short, in Anila Rogi, we can use all these things. Okay. So commentary also there comments the same thing. इदानीं सर्ववातव्याधि मुक्तानाम् अनुक्तानां च सामान्येन सकलं प्रत्यनीकं स्नेहस्वेद इति स्नेहस्वेद न रूक्षस्वेदः तस्य वादकारित्वात् अन्ये तु स्नेहस्वेद इति विच्छिन्न पठन्ति. That means Snehasveda means some people say it should not be Rukshasveda, it has to be Sveda that is Snigdha in nature. Then Sneha Grahanam Punaha Uktam, Rasaha Mamsa Rasa, Sneha means Gritadayaha, Snehanvitam means that is किंचिदस्तु घृतादियुक्तम् इत्यर्थः अथवा स्नेहगुणयुक्तं यत् किंचिद् वस्तुः. देन् फलाम्लानि दाडिमादि अम्लीकानि संवाहनं सुखकरस्पर्शनम्. So in our practice also at my hospital Ashtangam, we call Abhyangam, Samvahanam, two different procedures. Abhyangam is like with Mardanam they do. When I say Samvahanam, it should be simple with massage with no pressure at all. So Samvahanam is actually Sukhakara Sparshan only. Kausheya Avaranani, Kausheyam Koshakara Krimila, as in the different kind of clothes. Garbhagrihani means Apavarakadi Artaha. So you have to be staying in a closed space. Okay. So I think these are the things, and further he explains the different yogas. Okay. Then so practically, as I mentioned, it's not in my knowledge, I don't know any other place who are practicing or making it. Anutailam, this Anutailam is not again available. Sahasra Pakatailam are differently made. Patra Lavanam, which is there's a very big pot wherein these patras, Gandharvasta, Naktamala, Atarusha, etc., along with Lavana, then it is tied and then it is done Kutapaka and then heated and inside it again. That Patra Lavana then. Lavanam, Kalyana Lavanam. I don't have much to comment on that in terms of, because I have no experience in that. Finally,
Excuse me, ma'am.
So, yeah. So, go the chapter. As the mention the commentary of that
Excuse me, ma'am.
Excuse me, ma'am.
Yeah. Any questions to be asked? Yes.
No, ma'am.
As I mentioned, in this context, these preparation, I think whenever I read this preparation of Kandalavana and this Patralavana can be practically thought of. Anutas format, I think it's if those the earlier chakkis that are used to make taila, this different chakkis, no, and the fact remains that after usage of it for many years, there will be oil absorbed in those materials. So naturally, when we are using it, you cut it, that chakki, wood of the chakkis, then you boil it, the oil that comes in the out of that, that is taken and that is processed with other dravyas with kalka. That is used as anudaila for abhyangam. Okay. So that can be tried, but in my understanding, again, it's not available. Yeah. So any questions can be asked. Otherwise, we'll end the session. Okay.
I think there are no questions, ma'am.
And shall we leave if nothing to be asked?
I think there are no questions, ma'am. Can we continue tomorrow, ma'am?